Dr. Anas Rahim, D.O., believes in giving back. The Texas pain interventional management specialist, whose background is in anesthesiology, has dedicated his career and his personal life to compassion and service to others. The son of Syrian immigrants, Rahim recalls his father, a pediatric hematologist and oncologist, establishing his own medical practice in Panama City, Florida, where Rahim grew up as the eldest of 3 children. "My parents raised me with a strong work ethic, instilled in me the importance of religion and spirituality, service of others, and always emphasized family. An important addition is a tenet of my faith that states, 'Do unto others as you would like done unto you.' I feel if I follow this basic principle, I'm always able to make sure I'm doing the right thing for my patients," Rahim says. Dr. Anas Rahim learned from his father that it's not just how much you know as a doctor, but how you communicate with your patients that matters. He learned the importance of having great bedside manner and establishing rapport with patients from his father. Drawn to service at a young age in the last 2 years of high school, Rahim was dual-enrolled at Gulf Coast State College, where he became involved in student government and served on the Student Government Executive Board during his senior year. As part of his role, he served as the community service chairman for the college, initiating the Adopt a Highway program, continuing Habitat for Humanity projects, and collaborating with local leaders to establish multiple community projects. After high school, Rahim attended the University of Florida, where he majored in food science and human nutrition. Following graduation in 2012, his community service continued as he served on the board of a local service group called Project Downtown, which serves meals to the homeless once a week. He recalls with pride that during his 2-year term as treasurer of the organization, it became the first Project Downtown chapter to be listed as a 501c3 nonprofit while also expanding to serve 2 hot meals each week. Inspired by a medical mission trip, then came medical school. After his first year in 2014, Rahim went on a medical mission trip to Syria. The Syrian civil war had started in 2012, and as the news continued to pour in of innocents being killed, he wanted to go back to the country his parents emigrated from and help those in need. "I spent a week in the of a hospital that had been bombed a month prior by the Syrian regime, and every night at sunset, you'd hear alarm bells go off, indicating that the military was dropping bombs over civilian areas. Like clockwork, 10 minutes later, the was filled with patients brought in by ambulance. I watched as a bystander, not sure what I could do or how I could help. It was nothing I had seen before, akin to being in a movie," Rahim recounts. He watched as doctors, nurses, and anyone who could lend a hand worked to help those who hadn't already passed. Rahim worked alongside an anesthesiologist who helped both in the and in the operating room. The ability to quickly manage patients' pain and keep them safe during surgery spoke to Rahim, leading him to pursue anesthesia as a career. "I started my residency in anesthesiology at the University of Florida in 2017, back to where my educational journey started. It was a very proud moment for me," Rahim says. "The importance of mentoring, my mentors have served as enduring touchstones throughout my career," Rahim says. "Just knowing I had someone to turn to for sound advice made a world of difference in my confidence and my comfort," he adds. Rahim's mentor during his residency training, Dr. Goldstein, a cardiothoracic anesthesiologist at the local VA, was instrumental in his professional growth and in how he interacted with patients. He was not only great at communicating to the residents how to act, but he was even better at playing the part with his patients, treating our veteran patients with respect, dignity, and compassion, all the while being a great role model to his students," Rahim recalls. Remembering how important having a mentor was in shaping his career, Rahim now mentors the next generation of physicians. His own training 4 years ago is still fresh in his mind, and it informs how he mentors. "I vividly recall what things I did and did not appreciate as a trainee physician. I worked towards building on the things I liked, teaching, being approachable, pleasant, and worked to eliminate qualities that were tough for me to deal with, throwing trainees under the bus. One of the most important qualities a good mentor has is being approachable and non-intimidating," Rahim says. Guiding future pain management specialists is incredibly fulfilling, according to Rahim, because it's not just about teaching techniques, it's about shaping compassionate, thoughtful clinicians who can truly make a difference in patients' lives. Contributing to the next generation of pain management specialists helps ensure that the specialty continues to grow, evolve, and maintain high standards of care, he explains. The most gratifying moments for Dr. Anas Rahim are when former trainees reach out after graduation, sharing how they applied lessons learned during fellowship to make a meaningful impact on a challenging case. It's a very proud feeling, he says. Mentoring others has contributed to Rahim's own development as a physician and educator. Mentoring, most importantly, deepens knowledge. In order to share knowledge, you want to make sure you're truly knowledgeable before sharing. It also allows an opportunity for self-reflection. Guiding others often makes me more introspective about my own practices and decisions, and I critically evaluate myself. Family life in the future outside the clinic. Dr. Anas Rahim finds his greatest joy at home with his wife, Jinan Erkid, and their children. Whether it's sharing family dinners or weekend beach outings, their bond is the heart of his world. He and his wife also share a passion for travel, with a quest to visit every national park in the USA. As Dr. Rahim looks to the future, his primary goal is to expand access to pain management services to underserved communities. Pain affects everyone, regardless of their background, and I want to ensure that everyone has access to the care they need, he says.